Hello, I'm Dr. B.
Hi.
Can you confirm your first name for me, please?
Rachel.
Okay, great. So Rachel, I have you in here for a bit of a head-to-toe check. Is that correct?
Yes.
Perfect. So before we get started, anything that's bothering you right now?
No.
Okay. And on a scale from 1 to 10, 1 being no pain at all, and 10 being the most excruciating pain you've ever experienced, are you in any pain right now?
No. 1.
Perfect. So I'm going to basically go head to toe, and I'm going to just run through all of your functions and your vitals and make sure everything's working properly. You should do this about once a year, just to make sure there's nothing major wrong. Starting up at your head, just to make sure any headaches or dizziness, fatigue.
No.
Okay. How many hours a night are you sleeping generally?
About 7.
Okay. And is that enough for you? Do you feel well rested?
Yeah.
Okay, good. And moving down to your vision, any blurriness, double vision, changes in your ability to see?
No.
Okay, do you wear any glasses or contacts?
I do.
Okay, and you have them in now?
Yes.
Okay, perfect. And that prescription is working for you?
Yes.
Wonderful. Well, we will double check that. But, any issues with your sinuses, pain, swelling?
No.
Okay. And no changes in your smell either?
No.
Okay, and with your mouth, I can't see any major sores on the outside, but any issues with taste or pain in the mouth, teeth, that kind of thing?
No.
Okay. And any issues with your heart feeling fluttering or too fast, too slow, anything like that?
No.
And what about your breathing?
Breathing's good.
Good. No history of asthma or anything like that? Stomach, any issues currently with your stomach, food sensitivities?
Gluten-free.
And gluten-free. And is that diet working effectively for you? Okay. And what about changes in your strength in your arms and legs, anything like that?
No.
Okay. And any tingling or cold hands and feet that just is uncomfortable for you?
No.
So you seem pretty healthy, but we'll go ahead and do a full check. Just gonna give my hands a wash here. May I touch you?
Yes.
Okay. I'm just going to start out and just look straight ahead for me. I'm just going to palpate the head. Any pain or tenderness here?
No.
About back here. Okay. Just going to look through here for any obvious signs. Hair looks healthy. Doesn't seem to be any bruising or swelling. You said you're not getting headaches, right?
Right.
Okay. Just check this side. Hair is really healthy. It does look like there's some color in there, but there's really not any brittleness, no hair loss that I can see. Tilt your head down for me, please. Looks great. While I have this, I'm just going to take a look at the face. Close your eyes for me. So I don't... Your eyes. And the skin looks nice and even. Just going to check for temperature. Consistent temperature. I'll take the temperature here. It's going to go on your forehead and behind your ear, okay? Okay, 97.9. And 98.3, so that's perfect. Can you stick out your finger for me? Put this here and just relax it on your, there. I'm also going to take your blood pressure. So that's 99% oxygen and 72 resting heart. An arm preference?
This one's good.
Okay. So I'm actually just going to have you turn your arm and put this right on your wrist here. And just press it right there. It's gonna get a little tight, okay? Good. Good heart rate, and the blood pressure is normal. Let's take a look at your eyes. First, just your eyebrows are nice and symmetrical, as well as the eyelashes. Can you look up for me, please? And look down. And look straight ahead. I'm just going to shine this light in your eye, and it's going to be a little bright. I do apologize. Okay, great. I'm just going to shine right in the middle there. Perfect. I want you to, can you see my pen right here? And is it clear for you? Any double vision?
No.
Okay. I'm going to move it in a couple of different directions, and I want you to just follow the pen. Don't move your head. Just use your eyes. I want you to tell me if there's any double vision or if you lose sight of the pen at all. Any issues there?
No.
Okay. So look way out at that wall behind me. Ignore my pen. And now look at the pen. Okay, and follow it now. Good. Good constriction. Check the pupils. And it looks great. I'm going to look a little closer at the eye, and it's going to involve me getting quite close. So again, just stare right off into space there. I'm just going to get really close. Okay, same thing on this side. Back of the eye is clear. See the red reflex. You said you can, your prescription feels right for your eye, right?
Yes.
All right, so hold this about 14 inches away from your face, and I want you to go ahead and read that very last line for me.
LTFPH.
Very good. Cover one of your eyes with this. You can choose whichever one. And do the same thing backwards for me, please.
HPFTL.
Okay, and switch eyes for me. And forwards once again.
LTFPH.
Very good. I'm going to have you hold on to that card. Cover one of your eyes again. Okay, great. I'm going to stand right here in front of you, and I want you to just stare at my nose. I want you to tell me when you see my fingers wiggling.
No.
Perfect.
No.
Okay.
No.
Very good.
No. No.
Okay, and switch eyes for me, please.
No. 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 No.
Very good. And without those, I'm going to have you again look straight at my nose. I'm going to hold up a couple of fingers, and I want you to say right or left or both for which ones are moving.
Okay. Left. Both. Right.
Okay, and how many fingers do I have up on this
2.
side? And what about on this side?
3.
Very good. Peripheral vision looks great. Got some colors here. I want to test your ability to differentiate colors. So, what color about would you say that is?
Like a reddish brown.
And then what about this color?
Lime green.
Very good, very specific. And what about this color?
Blue.
Okay. And one more.
Pinkish red.
Very good. So even though these are relatively close in tone, you're able to differentiate, so that's great. On some gloves, I'm going to take a look I'm going to touch the top of the eyes quickly, and then I'm going to move down to the nose. So again, I'm just going to gently press right here. Any pain there?
No.
What about in the tear ducts?
No.
Anything when I press down here?
No.
Here.
No.
Alright, take a look at the nose now. As you see, you have several piercings. Any discharge or redness?
No.
Okay. So I'm going to look inside, so I'll have you tilt your head back just a little. Okay. Looks clear to me, and the piercing on the side. Okay, look nice and healthy and healed. How long have you had those?
About 4 months.
Okay, so they actually look pretty healed for only 4 months. I'll have you cover one side of your nose and breathe in for me. Okay, seems clear. Do the other side for me. So you have good patency. Let's go ahead and test some of your smell. I've got 2 fragrances here. And I'm not going to show you what they are, and I want you to just take a smell and tell me what you think you smell.
It's like a orangey smell.
Yep, it's a lemon citrus, so that's just about right. And same thing over here. You did
Mint.
Yes, peppermint, wonderful. So that sense is intact. I'm gonna take a look inside the mouth, and you said no issues with taste, correct?
No issues.
Okay. Say ah for me. Okay. Okay, you can close your mouth now. I want you to clench your teeth. One more time. Okay. Open and close your jaw. A little bit of clicking there. Is that normal for you?
Hello.
Okay. Any pain when that happens?
No.
Okay. You push against my hand with your jaw. Very good. And push against me here. And pull back. And turn into my hand on this side. Okay, strength is good. Rest your shoulders. All right. I'm gonna have you make some faces for me. So that's a nice smile. Lift your eyebrows up and close your eyes nice and tight. Don't let me open them. Can you puff out your cheeks? And don't let me close them. Can you push your tongue strength into this hand? Very good, very strong. In this hand. Okay. Just gonna get some basic symmetry of the face measurements wise. And then we'll move down to the neck. So we'll just keep those in the file. We can test for swelling or any changes in that over time. And move down to your neck now. If you mind, let's move your hair out of the way. Is that okay? Yeah. First thing I'm gonna do is just feel for your lymph nodes. Let me know if you have any pain or tenderness here. Any of that bother you?
No.
Shrug your shoulders for me. I'm just gonna get it right here. Okay, and relax. Okay. I'm gonna come around here. I want you to swallow for me. Do you need a cup of water?
Sure.
Okay. All right, so here's a cup of water, and I'm just gonna have you take a sip and hold it in your mouth. Okay, and swallow for me. Very good. Okay. All right. And I just want to look at the veins here. No pulsations. Just just one at a time. I think I listen to some of your pulses later, but I want to quickly check your ears. You do also have some piercings in here, and looks like these are nice and healthy as well. Just check the back. There's no bubbling or redness. Looks really good. Any pain when I press on the ear?
No.
What about right here in the middle?
No.
And same thing on this side. Any pain?
No.
That's okay. Let's take a closer look in here. It looks fine, but I do want to test some of your hearing now. So I'm going to hit this tuning fork. I'm going to place it right in the middle of your head. I want you to tell me if you hear it more right, left, or equally.
Pretty equal.
Very good. And then tell me when you can't hear that anymore.
No.
Can you still hear it here?
A little.
Okay, perfect. As long as it's a little bit, the bone conduction should be a little less than the air conduction. Same thing, tell me when it goes away.
No.
Can you still hear that there? Okay, wonderful. I've got just a little puff of air here. And I'm going to put it on your right side, your left side, and tell me which one you hear it on. So again, close your eyes for me.
Right. Right. Left. Left. Right. Left.
Okay. I'm going to whisper something in your ear, and I want you to just repeat it back to me. ASMR.
Hazel.
Try that one again. Dog.
Dog.
Okay. Same thing on the other side. Cat.
Cat.
Okay. Very good. Yeah, that first word was a little complicated. It's okay. You're able to hear just fine, and we've had this conversation as well, so I'm not worried about your hearing. While we're up here, let's test some of the sensation in the face. Just looking for my, let me do it with this. So I have a bit of a, if you give me your hand, a little bit of a soft, and then a little bit rougher. It's not sharp, but it is rougher, okay? I want you to tell me what you feel in your face, either soft like this or rough like that. You feel a difference?
Yeah.
Okay, so close your eyes and just say sharp or dull.
Dull. Sharp. Sharp. Sharp.
Good.
Dull. 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 Sharp.
Okay, and does this feel the same as that?
Yeah.
That's the same?
Yes.
Just like that?
Yeah.
Okay. I've got a bit of cool metal here. This tuning fork is quite cool. Feel that? Does that feel cold here and here?
Yes.
And is it the same cold?
Yes.
Okay.
Yes. Yes.
Okay. While I have this, I'm going to hit this. It's going to make a little bit of a buzzing sensation. So if I do this, and that's buzzing, and that's just pressure, okay? So you feel the difference between vibration and pressure?
Yeah.
All right, close your eyes, and again, try and really feel the pressure and vibration and ignore the sound.
Okay. Vibration. Pressure. Vibration. Pressure. Vibration.
Good.
Pressure.
Okay. Alright, so just relax and breathe normally. I'm just going to have a listen here. Okay, I'm actually gonna have you breathe a little deeper when I press you here. I'm gonna just be taking a look at the lungs. Is that all right? Or taking a listen to the lungs rather. And I'll lay you down to do your heart. Nice big breath. One more. Okay, I'm just gonna go underneath here. Just like that. Okay, and last one. Okay. I'm gonna do some tapping right here, is that all right? Okay. Okay, that all sounds the same. I'm gonna place my hands in 2 spots, here and here. I want you to say 99 for me.
99.
Okay.
99.
Okay, good. I will have you just swing your legs around for me. I'm going to take a look at the back now, okay? I'm going to move your hair just out of the way here. And same thing, I'm going to listen to the lungs. So just take, it doesn't have to be super deep, but a little bit deeper than normal breath when I touch you. Okay, and relax. And a couple more times for me. And last one. Very good. I'm gonna tap one more time on the back here. Okay, and say 99 when you feel my hands.
99. 99. 99.
Okay, can you take one deep breath in for me? Good, good lung expansion. While I'm back here, I'm going to be feeling the spine. Any issues with scoliosis?
A little.
Yeah, okay. Definitely do feel a little bit curved. Can you tilt your head down for me? Like you're going to take a dive into a pool. Sort of go forward and then come up slowly, 1 vertebrae at a time. Yep. Just a slight curve right there. Okay. Any pain when I hit you like that in the kidneys? Like that?
No.
Okay. Do some range of motion. Can you just twist side to side? Yep, very good. And tilt down like this. Okay, and the other way. Okay, can you tilt your head all the way back as far as it'll go? Okay, and all the way forward as far as it'll go. And can you turn it side to side for me? Just checking the neck as you do that. And that's a good range of motion. I'm gonna have you lay down on your back, top side up, and I'm gonna do some sensation in the arms and check your heart as well. All right, I'm just gonna listen to the heart here. And just breathe normally for me. And are you doing aerobic exercise at least a couple of times a week, walking or something?
Yeah.
Okay, perfect. Okay, everything sounds fine. As long as I have this, I'm just going to listen to the stomach here. And how long have you been on that gluten-free diet?
About a year.
Okay. Everything sounds fine. I'm just going to tap really lightly here. Any pain when I do this under here? Out this side? Okay. I want to test the sensation of your arms now with you laying down. And it's going to be very similar, where first I want you to tell me if you feel it at all. So just say yes when you feel it and close your eyes for me. It's that light touch again.
Yes. 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 Yes.
Good.
Yes. 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 Yes.
Okay, and now I'm going to do the sharp dull. So again, this is a little bit rougher than this. Feel the difference?
Yeah.
Okay, say sharp or dull.
Sharp. Sharp. Dull. Sharp.
Good.
Dull. Sharp. Sharp. Sharp.
Right. Is this cold?
Yes.
Okay. Do you feel the difference between that temperature and this temperature?
Yeah.
Okay, can you just say cold or warm?
Cold. Warm. Cold. Warm. Cold.
Good. It's okay.
Warm. Cold.
Okay, same thing on this side.
Cold. Warm. Warm. Cold.
Okay, I'm gonna hit this. It's gonna make a little buzzing. Say vibration or pressure.
Okay. Vibration. Pressure. Vibration. Vibration.
Good.
Vibration. Pressure.
Okay.
Vibration. Pressure.
Good.
Vibration. Vibration.
Good. I'm gonna touch you on part of your body. I want you to say left, right, or both.
Left. Right.
Okay. And I'm gonna touch you, and I want you to tell me what part of your arms I'm touching.
Hand.
What side?
Right hand.
Okay.
Left arm.
Okay.
Right arm.
Okay. So you can differentiate where you are in time and space as well as what's interacting with you, which is great. We'll do a few more neuro tests when you sit up. For now, can you raise both arms over your head? Okay, and back down. And can you go like this? And resist me, push me away. Okay, and pull me towards you. And just, keep your hands turned this way. Perfect, and pull me towards you. And same thing with the wrists. Can you push me down? And pull back, your fingers back towards me. Very good. Okay, you can relax. And I just want to move down to the legs to do some strength testing as well. So first, can you just lift this leg up off the table and down? Okay, and can you do it against my hand? Very good, and pull me down. And knee up towards the chest. Yeah, very good. Let me just move for you. Any pain in the knee joint there?
Mm-hmm.
Okay, push me away and pull me towards you. Foot up. There you go. And push down. Okay, relax. Same thing on this side. Up and down for me. And can you push me and pull? Good. And knee up and back. Just checking the joint of the knee here. Okay, and push out for me. And pull in. And with the foot, in and out. Okay. Really good strength testing. You do have the jeans on, so I'm just going to roll up just a little. Test the sensation. You said no coldness or tingling in the feet, right?
No.
Okay. You feel that on that side?
Yes.
And that there? Okay, what does this feel like?
Sure.
Okay, what about this?
Oh. Sure.
Okay. And I've got a little bit of a sharp tool here. I'm just going to use the back of this. I'm just going to run it down the leg and tell me if there's any loss of sensation or if it feels the same all the way down. Does that feel the same? Okay. That feels okay. All right, well, I have you able to do your reflexes, so I'm just going to turn you here. I'll move your sweater. And just sort of relax your leg, but turn it to the side. So like that, exactly. And just go completely loose if you can. Okay. Good. And the same thing on your knee, so just completely relax. Just give me all the weight. Just relax. There we go. There we go. Perfect. Same thing on this side. And this one can go out straight. There we go. And give me all of your weight. Just relax fully. There we go. Perfect. All right. I'll have you sit up to just complete a few neurological things, okay? So you can just swing your legs around. All right, now that I have you sitting up, I want you to do a couple of motions for me. So I want you to touch all your fingers in a row. Can you go as fast as you can? Okay. Touch your nose with your pointer finger and touch my finger. And back to your nose and back to my finger. Keep going. And can you switch hands? Very good. Can you run your leg as fast as you can? Perfect. And take this heel and run it down this shin. Okay, and on the other side. Very good. I'm gonna ask you a couple of questions I want you to answer. Can you tell me who the first president of the United States was?
George Washington.
Okay. And what is the weather like today?
Sun.
Okay. So you've got long-term memory, short-term memory intact there. I'm going to have you do some math for me. So if you have 100 and you take 7 away, what do you have?
93.
Okay. And take 4 away from that.
89.
Perfect. Very good. Yeah, I know we don't have to do math in our heads too often, so it's good to keep practicing. I'm going to draw a couple of numbers in your hand. So you can just give me this one and close your eyes, and I want you to tell me what number I'm drawing.
1.
All right, and how about on this side?
6.
Very good. And add those together.
7.
Okay. All right. So I'm going to move your finger up or down. You feel the difference?
Yeah.
Okay, close your eyes and just tell me up or down.
Up, down, down, up,
Okay, same thing on this side.
down, 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 up.
All right, wonderful. You can sense that just fine. Stare straight ahead. Don't pay attention to me at all. Okay, keep looking there. Don't look at me. I'm going to tap here. Same thing, just focus. Okay, let your jaw hang for me. Good. I'm going to do the reflexes in your arm, so just completely relax my hand here. Very brisk reflexes, which is good. Okay. There you go. And I'm going to do the same thing over here. And just relax fully. There you go. Okay. So all your reflexes are intact. A little brisk on that left side, but nothing concerning. Just something to watch. If it gets worse, we can do other testing, but there's no other indication that you'd have any sort of neurological issue. I'll check my notes to see if I missed anything, but I think you're in pretty good shape. All right, Rachel, well, it looks like all of your main functions are intact today. Do you have any questions about anything we went over?
No.
Okay. I would say just come back again in a year for another checkup. But you look really great and really healthy. I'm glad that gluten-free diet is working for you. Don't change anything. If you start experiencing any other issues in the stomach, we can do some other exclusionary dietary tests there.
Thank you.
Thank you.